to discuss the president's plan is Dr. Elizabeth Clayborne. Dr. Clayborne, it is a pleasure having you join us. Are you there? All right.
Yes, I am. I'm here.
Dr. Clayborne, there you are. All right, so you heard the president's response. I mean, acting quickly, not wasting any time. So far, 3 cases have been detected here in the U.S. Are you afraid that there are more cases and that the horse has already been let out of the barn at this point?
Absolutely. One of the things I think we need to keep in mind is that we actually don't really have great surveillance going on in the United States. We really need to thank our colleagues in South Africa for picking up the Omicron variant, which has likely been circulating the globe for some time. So I will not be surprised at all when we start to find that there are multiple cases, hundreds to thousands of these cases that are probably already in the United States. And that's why this should be really a wake-up call for the majority of people who are, not vaccinated and really have no protection from the new variants that are coming and will continue to come, because this is probably going to be a virus that will be endemic and around for some time. And Omicron is the newest and most concerning right now, but there will be others in the future.
Yeah. Dr. Clayborne, as an emergency physician, what concerns you the most about this new variant?
Well, what I'm most concerned about is that we just came off of the holidays, the Thanksgiving holiday, where a lot of people traveled. I know that everyone has pandemic fatigue and people really wanted to get together with their families, but I'm afraid that that probably set us up for a perfect storm. We were already anticipating a surge in COVID-19 patients that was associated with the winter months when the air is cool and dry and people are more likely to be indoors. That was already going to be a setup for us to have increased numbers of cases. And now the travel associated with Thanksgiving and the Omicron variant really puts everything in place for us to have a significant surge that might lead to significant steps backwards in our battle against COVID-19. So I am worried that, as you said, the horse is already out of the barn and that we're going to be playing catch up and leading up to the upcoming holidays in December when people again want to travel and get together with their families. I'm worried that, people are not going to take it seriously and that it's going to result in a number of illnesses and deaths related to COVID that can be prevented if we take action now and listen to a lot of what Biden's plan has laid out. But most importantly, to go get vaccinated and get boosted, as he mentioned. That is our best layer of protection.
Dr. Clayborne, are there any protocols that are being put in place where you currently are in terms of how to handle a possible surge?
So one of the things I want to remind people is that our hospital systems, including my own, are already extremely stretched thin. We are constantly battling a nursing shortage. When I go into work, we are understaffed. It's been going on for months. And so there is really not a lot of room for us to deal with a surge. What will happen is that, people who don't have as significant illnesses will probably be asked to stay home or seek care in an outpatient setting so that we can accommodate the sicker, more serious patients that come in. And that is just not a great position to be in. I think that everyone thinks about, well, I'm not that worried about getting sick from COVID. What you need to think about is if you get in a car accident, if you have a stroke, if you, have some other issue that I need to see you for as an emergency physician, I might not be able to do that if I'm dealing with a surge and already stressed staff that does not have the resources it needs. So all of this points back to the fact that the best way for you to protect yourself, your children, your family, and our community is to get vaccinated. And if you have questions about that and you're still on the fence, I encourage you to seek out a medical professional, a physician like myself that knows the data and can answer your questions and make you feel more comfortable, because now is the time to take action. This is a very dangerous game that you can play going on without getting vaccinated. And I certainly think that at my hospital, we are potentially preparing for the worst, but we really don't have that much room to accommodate a huge surge. And so we're hoping that we can have some preventive steps by encouraging our community to get vaccinated so we don't see huge numbers that we may not be able to take care of adequately.
All right, Dr. Clayborne, I got to go, but I just want to ask, you mentioned being stretched out. How are you doing? You and other health officials have been in this for 2 years.
Absolutely. And thanks for asking. I actually have a corona baby. I gave birth in May of 2020. She is 18 months old. It is crazy for me to
Wow.
think about. I basically worked through the first wave when we had no vaccine in sight. And for me to think about that, I continue to have to put her risk at health to work on the front lines and take care of other people is really something I hope I don't have to continue to do for that long. She's not eligible for a vaccine. And I do want people to remember that physicians like myself take a significant risk for themselves and their families to be there for patients. And we appreciate when you are thankful, when you are patient with us, and most importantly, when you do what you need to take care of yourself, so that you don't have to come see me.
Dr. Clayborne, thank you so much, and thank you for what you do, and happy holidays. All right.